The House will come to order. The clerk will read the journal from the preceding day.
Journal of the House, 89th session, 56th day, St. Paul, Minnesota, Thursday, May 7th, 2015.
If there are no objections, further reading of the journal will be dispensed with, and the journal will be approved as corrected by the chief clerk. Hearing and seeing no objections, the journal stands as approved by the chief clerk. Comparison reports. There are copies of this order of business at each member's desk. If there are no objection, the motion will prevail. Hearing none and seeing none, the motion prevails and substitutions will be made. Reports from standing committees and divisions. A copy of this order of business has been placed at each member's desk. If there are no objections to the reports, they will be adopted. Seeing none and hearing none, they are approved. Second reading of Senate files.
Second reading, Senate File 233.
Second reading.
Second reading, Senate File 1504.
Second reading.
Second reading, Senate File 1698.
Second reading. Introduction of House bills. The following bills have been offered for introduction today. The chief clerk will report the House files and give them their first reading.
Introduction and first reading of House Files 2315 through 2320.
First reading of House Files 2315 through 2320. Messages from the Senate.
Message from the Senate. Mr. Speaker, I hereby announce the Senate refuses to concur in the House amendments to the following Senate files. Senate File number 997, an act relating to insurance. Senate respectfully requests that a conference committee be appointed thereon. The Senate has appointed as such committee Senators Jensen, Metzen, Gazelka. The message is signed Joanne M. Zoff, Secretary of the Senate. Schumacher moves that the House accede to the request of the Senate and that the Speaker appoint a conference committee of 3 members of the House to meet with a like committee appointed by the Senate on the disagreeing votes of the 2 houses on Senate File number 997.
The member from Rock, Representative Schumacher.
This is my motion from yesterday's bill, Mr. Speaker. I would ask to take it to conference committee.
If there are no objections, so ordered. All those in favor signify by saying aye. Those opposed, the motion carries.
Message from the Senate, Mr. Speaker. I hereby announce the Senate refuses to concur in House amendments to the following Senate file. Said Senate file is herewith transmitted to the House with the request that the House appoint a like committee. Senate file number 1265, an act relating to insurance. Senate respectfully requests that a conference committee be appointed therein. The Senate has appointed as such Senators Jensen, Metza, Gazelka. And the message is signed Joanne M. Zoff, Secretary of the Senate. Davids moved that the House accede to the request of the Senate and that the Speaker appoint a conference committee of 3 members of the House to meet with a like committee appointed by the Senate on the disagreeing votes of the 2 houses on Senate File number 1265.
The member from Fillmore, Representative Davids.
Thank you, Mr. Speaker. Members, Senate File 1265 is the bill regarding insurance agents and providers. We have a few disagreements. We need to go to the conference and get it figured out.
All those in favor signify by saying aye. Those opposed, the motion carries.
Mr. Speaker, I hereby announce the passage by the Senate of the following Senate files herewith transmitted. Senate file numbers 86, 229, 634, 856, 871, 1025, 1587, and 1735. And the message is signed Joanne M. Zoff, Secretary of the Senate.
First reading of Senate files.
First reading, Senate File number 86, an act relating to data practices. Cornish moved that Senate File number 86 and House File number 222, now in the General Register, be referred to the Chief Clerk for comparison.
No objections, so ordered.
First reading, Senate File number 229, an act relating to gambling. Sanders moved that Senate File number 229 and House File number 374, now in the General Register, be referred to the Chief Clerk for comparison.
Hearing no objections, so ordered.
First reading Senate File Number 634, an act relating to lawful gambling. Atkins moved that Senate File Number 634 and House File Number 948, now in the General Register, be referred to the Chief Clerk for comparison.
Hearing no objections, so ordered.
First reading Senate File Number 856, an act relating to education. The bill is being referred to the Committee on Higher Education Policy and Finance. First reading Senate File Number 871, an act relating to higher education. The bill is being referred to the Committee on Higher Education Policy and Finance. First reading Senate File Number 1025, an act relating to civil actions. Lohmer moved that Senate File Number 1025 and House File Number 906, now on the calendar for the day, be referred to the Chief Clerk for comparison.
Hearing no objections, so ordered.
First reading Senate File Number 587, an act relating to real property. Franzen moved that Senate File Number 1587 and House File Number 1187, now on the calendar for the day, be referred to the Chief Clerk for comparison.
Hearing no objections, so ordered.
First reading Senate File Number 1735, an act relating to energy. The bill is being referred to the Committee on Job Growth and Energy Affordability Policy and Finance.
Hearing no objections, so ordered. Calendar of the day. The first bill on the calendar for today is Senate File 462. The clerk will report the bill.
Senate File Number 462, number 4 on the calendar for the day, an act relating to health.
The member from Washington, Representative Lohmer, to your bill.
Thank you, Mr. Speaker and members. Senate File 462, the Prenatal Trisomy Diagnosis Awareness Act, is a bill that was brought to me by a mom named Heather Bradley from Stillwater. She's a mom of 3 beautiful daughters. Her youngest, Isabel, was born with Down syndrome. Izzy's mom has become very involved with the Down Syndrome Diagnosis Network and asked me to sponsor a bill similar to one that has been passed in 7 states to date: Massachusetts, Kentucky, Pennsylvania, Louisiana, Delaware, Ohio, and Maryland. This bill simply states that when a prenatal diagnosis is made of one of the 3 trisomies, 13, 18, and 21, a healthcare practitioner who orders tests for a pregnant woman for screening purposes shall provide full, complete, and up-to-date information about the trisomy conditions to the mother. The Department of Health already has quality, up-to-date information on their website, and so the physician simply needs to point the pregnant mother to the website where she will find all the information. There's no cost to the bill since the department already has the information on their website. Again, the physician merely needs to point the pregnant mother to the health department's website. I want to mention what this bill does not do. It does not take away a woman's choice or decision-making regarding the pregnancy. It does not preclude the physician from giving medical advice to the patient. Now, I have some handouts that are coming around, and I just want to mention there's pictures and stories about Izzy and Michaela in these handouts. And it's really been fun to see Izzy as a featured model on the Target ad recently. And Michaela was actually recently crowned Miss Amazing. And she is amazing. She is a dancer who choreographs her own dances. And when she testified in our committee, she read her remarks off of her cell phone. She's a very impressive young woman. So this bill will also increase awareness for the 3 trisomies among the general public. And it also creates opportunities for more research and advocacy by educating families and people on how to care for children with trisomy. So, Mr. Speaker and members, I would ask for a green vote.
There are no amendments at the desk. The clerk will give the bill its 3rd reading.
Third reading Senate File Number 462.
Further discussion to the Lohmer bill. Seeing none, the clerk will take the roll. The clerk will close the roll. There being 117 ayes and 0 nays, the bill is passed and its title agreed to. The next bill on the calendar for today is House File 1792. The clerk will report the bill.
House File number 1792, number 8 on the calendar for the day, an act relating to health.
The member from Candy, Ojai, Representative Baker, to your bill.
Thank you, Mr. Speaker and members. Today I bring House File 1792 regarding nursing home receivership. This was brought to me by the Department of Health for some updates and some changes regarding when, on a rare occasion, the department has to step in and assist or take over a nursing home that is in receivership or becoming financially in trouble, where we are concerned the patient's risk might be patient's health might be at risk. The department steps in and takes over. So what this language does is it currently takes 5 days of receivership notice down to 2 days. So there's a quicker execution of the policy of the receivership motion. Also, it allows the department to have a managing agent on standby, so that when they do step into a nursing home that is in trouble, they've got agents already teed up, ready to go in. Another component to the clarifications would be the roles of the receivership, the managing agent, what the legal service definitions are, and why a receivership can be sought. So with that, those are the components really of the receivership bill, members. I stand for questions, but it's a good bill. It's really about consumer protection and protecting our nursing home patients. So with that, I stand for questions. Thank you.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File number 1792.
The member from Hennepin, Representative Loeffler.
Well, thank you, Mr. Speaker and members. I just rise to say this is a good bill. It's really going to assure continuity of care when one of these facilities that a lot of people with health challenges rely on runs into trouble, and I urge all members to support it.
Further discussion to the bill? Seeing none and hearing none, the clerk will take the roll. Members, please vote. The clerk will close the roll. There being 118 ayes and 0 nays, the bill is passed and its title agreed to. The next bill on the calendar is House File 1535. The clerk will report the bill.
House File number 1535, number 9 on the calendar for the day, an act relating to human services.
There is an amendment at the desk. The clerk will report the amendment.
Mack moves to amend House File number 1535, the second engrossment, and the amendment is coded A10-1.
Representative Mack, to your bill and to your amendment.
Thank you, Mr. Speaker and members. Members, just to the bill to start, House File 1535 is the Department of Health and Human Services Omnibus Bill. The Department of Human Services, members, is the state's largest agency, serving well over 1 million people with an annual budget of about $11 billion. And members, the bill in front of you today is a compilation of changes. Every couple of years we have one of these bills that the department puts together that's the product of working with stakeholders, getting feedback from the people that they serve, making sure that the laws that we've passed are workable, making tweaks here and there, and cleaning up language in current statute. And so in large part this bill is very technical and deals with several different things. Just to give you a brief walkthrough, members, of what this bill is dealing with, in Article 1 it's dealing with children and families, particularly when it comes to the Indian Child Welfare Act. Basically the changes come about through a cooperative process between the counties, the tribes, and the department, and will increase consistency across counties and strengthen the laws that bring us into compliance with federal law and create consistency across statutes. Article 2 deals with chemical and mental health services. It relates to chemical health by increasing access to services, especially in rural areas, and it also addresses clinical and administrative standards of the children's mental health and rehabilitation benefit. Article 3 deals with direct care and treatment. Basically makes sure that the that it's dealing with the White Earth Nation and Red Lake tribes, that they have to contract with the Minnesota Department of Human Services for their civil commitment hearings. Article 4 deals with operations. Basically, this article is making sure that DHS can do the best job in preventing financial fraud, in conducting fraud investigations, some cleanup that's been needed to make sure that they can do their work efficiently and effectively, and clean up the fraud that many of us seek to address. Article 5 deals with health care. The changes in this article basically do two things. First, it would ensure the medical assistance clients who are served by home and community-based services and receive a tablet as an augmented device would only be given one device, making basically just a technical change, making sure that they would not be able to get 2 tablets when it's not needed. And it also provides an exemption to the electronic health record requirements that we will get back to here shortly. And then Article 6, the final article, deals with continuing care, and basically our long-term care policies. Changes in the article address the roles of specific professionals in the assessment and support of the planning process for long-term care. It also aligns the vulnerable adult common entry point policies, and has a couple changes to the Community First Services and Supports program. So, members, that is a walkthrough of the bill. I want to thank Representative Albright, who carried House File 1677, that carried some components of this bill. This bill had many committee stops, and so there were pieces of this bill that had to be dealt with in public safety as well as government operations and transportation. And I want to thank Representative Albright for the piece of legislation he carried to make sure that this bill got through the process and was properly vetted in all the committees it needed to be vetted in. So, members, that is the bill. And then I understand, Mr. Speaker, we also have the amendment in front of us, the A10-1. And so, members, speaking to the A10-1 amendment, this is mostly some technical cleanup to the underlying amendment. We have a couple provisions in there dealing with child care and how records are kept and training is done, some issues that Representative Franzen worked on. There's also a piece in here that deals with our federally qualified health centers, making sure that this part of it has come forward to us from the federally qualified health centers. Members, we know that these particular providers are able to serve some of the people who need our help the most, the underserved, where a lot of the healthcare disparities are particularly come to light, and we're able to address them. And so as we continue to try to support the FQHCs, this amendment would direct DHS and the MNACHC to mutually develop a recalculation of the FQHC rates to reflect the changes in the service delivery model from the past 15 years. This would kind of bring them up to speed on what they need to make sure that their rates are reflective of the work that they're doing. So that is what that part of the amendment is doing. Members, there's also a part in the A10-1 amendment, something that many of you have probably been getting amendments, emails on, and that has to do with the issue of electronic health records. This has been an ongoing conversation in this session. The bill in front of you has as it is, has language in it that would exempt any provider that has 7 practitioners from having to comply with the electronic health record. What the A10-1 amendment does is it takes in language that Representative Pinto had that would basically exempt solo practitioners or providers that only accept cash to be exempted from our EHR records. And so, members, that's what that does. And then it also specifies when it comes to electronic health records, basically explains what is already in practice by the department, that no penalty shall be imposed on providers if they do not have an electronic health record in place. And I'm sure we'll have a discussion on this. Members, we have found, and many of you have heard from your constituents, particularly for smaller providers, the electronic health record mandate is incredibly burdensome for small practices. And we are the only state in the country that has a mandate for all providers to have to put in an electronic health record. This mandate went effective January 1st of 2015, and as a result, we have been contacted, I know I have been contacted from providers all over the state who have significant concerns about the burden that this is placing on them, many of them looking at retiring early or moving out of the state because they can't put up with the burden of a $15,000, $20,000 investment into an electronic health record system. And so we're trying to send a message to those providers that the state's trying to work with them, that while we think electronic health records provide a great benefit to their business, we're not trying to push them out of their state. We're not trying to put a burden on their shoulders that they can't bear. So that's what we're trying to accomplish with this amendment, members. And for that, Mr. Speaker, I would appreciate members' support and any questions.
Members, the volume is getting a little loud in the chamber. I'd ask that you take your conversations to the alcove or to the retiring room. There is an amendment to the amendment. The clerk will report the amendment to the amendment.
Norton moves to amend the Mack amendment to House File Number 1535, the second engrossment, and the amendment to the amendment is coded A11.
The member from Olmsted, Representative Norton, to your amendment to the amendment.
Thank you, Mr. Speaker. I'm going to read the portion of the amendment that Representative Mack just talked about to you so that you can hear what I'm leaving in place before I tell you what I've removed. This portion of the bill will say, individual healthcare providers in private practice with no other providers and healthcare providers that do not accept reimbursement from a group purchaser as defined in law, and it cites it, are excluded from the requirements of this section. So members, I'm leaving that in place. So the description that you just heard about the concern raised by some sole providers, I am not affecting at all, and they are being exempted. What I am removing is one sentence that follows that says the commissioner shall not issue a penalty to a healthcare provider for failure to meet the requirements in this subdivision. Members, I'm removing it because I believe the terminology of this subdivision is directing the department to not be allowed, should they so choose, and they don't at this time, let me be clear, issue some sort of penalty to a provider in the state who chooses not to comply with our law. This could be a large provider, any provider, and I'm concerned about the message that we send in this state by passing a law and then saying we're not going to enforce it. I think that's a rather dangerous precedent. So members, I know many of you received emails. I know I did. What I found in those emails is that there is a lot of misinformation being shared across the state. And so I'm going to take this opportunity, and it's going to take a few minutes, to explain what's in the law and what is not in the law so that we are clear and on the record. And I've talked with Representative Mack ahead of time, and she knows I'm going to do this, and I hope you will allow me the time. Members, in 2007, this legislature adopted the electronic health record requirement. It was done to accelerate the adoption and use of health information technology in order to improve healthcare quality, increase patient safety, reduce healthcare costs, and improve public health. We were moving ahead on e-health, and yes, Minnesota led the nation. So just to let you know what's happened since that 2007 decision. 93% of Minnesota clinics and 99% of our hospitals have electronic health records. 97% of our local health departments have adopted public health electronic health records. Work needs to be done with regard to the effective use of health information technology, and I believe that's some of the concern that the committee has dealt with this year. So what do we know about the use of electronic health records? 1,000 clinics were surveyed by the Department of Health. 95% of those surveyed said electronic health records enhances patient care. 92% said electronic health records alerted them to potential medication errors. 81% said electronic health records help them provide care that meets clinical guidelines for patients with chronic diseases. And 72% offer the ability for patients to access their personal health information to help them better take control of their own health. Some of you, like me, may have access to your health records online, and I do find it extremely beneficial. So what about that misinformation? I would like to clarify just a couple things, and I hope folks are paying attention out in the halls and across the state, but also in this body. Can a patient opt out of having their information shared between providers? Absolutely, the answer is yes. Minnesota law recognizes the importance of patient choice when it comes to care delivery and information flow, and allows patients to choose who their information is shared with. We've created a standard consent form, and I have a copy of that. And for those of you that have been receiving communication from folks in the mental health field, you should be relieved to hear that on this consent form that there is special permission needed by folks dealing with in the mental health area in order to release any information. In fact, it says there are certain types of health information that require special consent by law: chemical dependency programs and psychotherapy notes. And so I want you to listen to this, because this is information that I have heard time and time again in the last 24 hours. Psychotherapy notes are kept by your psychiatrist, psychologist, or other mental health provider in a separate filing system in their office, and not with your other health information. You must complete a separate form noting the release of that information. So, members, there's a lot of misinformation out there about this, and we need to make sure that our practitioners understand the truth. Secondly, does the electronic health record mandate that patient records and notes be put online? The Minnesota 2015 requirement that's being put into law right now does not require that patient information be placed online. The majority of electronic health records used by providers are not linked to the internet. The use of electronic health records is to be treated just like paper records. Thank you, Mr. Speaker. And those safeguards are protected by HIPAA and other laws that we have in the state of Minnesota. And then, with regard to my amendment and why I'm proposing it today, does the department penalize providers? No. Minnesota Department of Health does not issue fines or sanctions against providers that have not met the mandate required. Instead, members should know that the Department of Health has worked since 2007, when this law was put in place, and has been available to help providers comply with the law. In fact, there have been grant monies available, which are now depleted, which have helped folks be able to buy the product, to put their records on a secure system. Right now, as I mentioned, those are depleted. I'm disappointed that that account was not rejuvenated, but there are loans available for those that want them. The Minnesota Department of Health requires that some providers may not be able to achieve this, and has been a resource and will continue.
Members, please, again, the volume is getting to a point where I'm going to ask you to take your conversations to the alcove or to the retiring room. Thank you.
Thank you, Mr. Speaker. The department will continue to provide assistance for those providers in our state. Members, I think it's unwise to put something in law that says Minnesota doesn't care about electronic health records and is not going to enforce them. I think the Department of Health has been very clear, it's online, any provider can find it, that they are there to provide assistance to help those providers that are having financial difficulties. But members, the electronic health records are important to increase the efficiency and quality outcomes of patient care in this state, to help improve ability to avoid adverse events and have timely access to information for patients by other providers. Members, with that, I'm just going to sit down. I do think, I just want to reiterate, my amendment does not change what Representative Mack is putting in place at all. It's going to allow an exemption for providers. It just simply says that we're going to remove the language that says that the commissioner may not issue a penalty if they so chose at some time for any provider in the state of Minnesota. Thank you.
Discussion to the amendment to the amendment. The member from Wright, Representative Lucero.
Thank you, Mr. Speaker. I stand in opposition to the amendment, and I would hope members would vote red. Mr. Speaker, small clinic practitioners serve segments of our population that are most in need. The lack of certainty to small businesses creates instability and hardships, and that's what many of these small clinic practitioners are, small businesses. They are indeed small businesses, and when there are mandates in the law without a specific mandates in the law that create uncertainty, it's simply a disservice to the small businesses. I've spent years, Mr. Speaker, securing technology infrastructures with controls and protections in the medical industry. It is very expensive to do so. And to ask these small businesses to implement technologies is simply drives up cost, and what it does, the hardship creates consolidation. We want small businesses. We want these clinics to be able to serve the segments of our population that are most in need. But when there are mandates like this that create uncertainty, they simply will sell out and consolidate to larger organizations, and that is exactly what we don't want. So, Mr. Speaker, again, I urge everybody to vote red, members to vote red on this amendment, simply because we want to make it very clear that we do not want to create a hardship to our small clinic practitioners. Thank you.
The member from Dakota, Representative Mack.
Thank you, Mr. Speaker and members, and thank you, Representative Norton, for the amendment. And I understand what you're trying to accomplish, and members, I understand kind of the awkward situation that we are in with electronic health records and the fact that there is this law in the books. However, the department has been clear that they do not impose penalties for not complying. They don't intend to impose penalties, and I appreciate that they have been working since 2010, as Representative Norton pointed out, to work with providers. However, the fact is that we still have, I think Representative Norton said we have like 93% of our providers now have electronic health records, and that's phenomenal. I think we've gotten a long ways down the road to what we're trying to accomplish. But the fact is that the ones that are remaining outside of compliance and not having electronic health records are the ones that can at least afford to put them in. And in addition, that we can least afford to lose in our healthcare system. And so, members, I understand that putting in language that stipulates that there won't be a penalty is awkward for some members. But I think it's a message that we need to send to providers that we're trying to work with them, that we want to keep them here in the state, that we don't want them to close their doors early. And unfortunately, the message hasn't gotten to them fast enough from the department. And I understand the department wants to continue to do work to get that message out there to them, that there's not going to be a penalty, that the state wants to work with them. But members, I'll just say again, we're 5 months into a mandate requirement, and some of the providers, many of which you guys have heard from, are panicking. And I will also argue, members, that these providers, they don't want to be outside of the law. They're very uncomfortable with that in and of themselves. So just the fact that there's not a penalty, I don't think that's just going to make them shrug this off. When I've had providers contact me and I've said to them, there won't be a penalty imposed, they'll still say to me, but isn't this the law? And I'll say, yes, it is the law, that you are supposed to have an electronic health record. So there's already this heartburn of living outside of the law, and I believe that these are good, hardworking providers who truly want to comply, and because of the burden of mostly what I'm concerned about is the cost of what they're looking at. And so by saying this in law and putting this in this amendment, I'm trying to send a message over the bow to those providers, understanding so that they know there's not going to be an additional financial penalty for not complying. And I truly think that they will continue to seek how they can come into conformity with the law. And in addition, members, there are some loan forgiveness programs that the department has. There's a grant program that hasn't been funded or refunded, I should say, and I think it's something I know Senator Sharon's interested in looking at, I'm interested in looking at, that would help offset the cost of putting in an electronic health record. But until some of those things come into place, I realize that there's a bit of a cost and awkwardness to putting something like this, that there's not going to be a penalty, but the fact is that is the practice of the department. I think that message needs to be sent to the providers, and I think that we need to make it clear that we are supporting them, trying to keep them in this state and appreciate the good work that they do, and not add a burden to them that's going to drive them out, and I think that this is the best way to do that. So I would respectfully ask for members to vote against the Norton Amendment. Thank you, Mr. Speaker.
The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Well, thank you, Representative Mack. And Representative Mack, I do support what you're trying to do here in terms of exempting the very smallest providers and the rest of your amendment. I think the problem, Representative Mack, the problem with this last sentence, the one that Representative Norton is trying to remove, is that it's way too broad. It isn't only about the small providers. If it was, I would support that language. It's a very broad statement. It says the commissioner may not issue a penalty to a health care provider for failure to meet the requirements of this subdivision. That's everybody. That's everybody, and that's a bridge too far. I would say if Representative Lucero really is concerned about a burden on providers, he should offer a bill to remove that requirement, not say, we'll never penalize you for failing to meet the law, then change the law. And I know that's what you're doing in your underlying amendment, in the amendment here, and that's fine. As I say, I'm fine with exempting those individual healthcare providers in private practice and those who don't, accept cash. You know, I'm fine with that. I do think I do think there should be some exemption. But that last sentence is poorly crafted. It doesn't do what it's supposed to do. It's very, very broad. And again, this is really unfortunate that here on the House floor, because of the pre-file rule, we can't go and fix things. It's either yes or no. And once again, we're in that bad position where it's got to be either up or down on something. We can't fix it. But we should be fixing this language. It is really a bad practice, even if they don't impose a penalty. It's really a bad practice to say, yeah, we've got a law, but just ignore it. Nothing will happen to you. You know, what if we said that with the speeding laws? Yeah, there's a law, but just don't comply. It's okay, what the heck. We made the law, but never mind, doesn't apply to you, because we'll never enforce it. I just think that's a really bad practice. And I don't think we should be doing that here. At the same time that you're exempting certain people, good, fine. They're not going to, you're exempting them. They don't have to worry about a penalty. Why put in a line that says everybody is exempt from a penalty? That just doesn't make sense to me, Representative Mack, and I really think it breeds disrespect for the law, and there's a different way to do that. If you really want to exempt more providers from this requirement, then exempt them. Don't pass your amendment. But I don't think this is a good thing to do, and members, please support the Norton Amendment to the amendment.
The member from Dakota, Representative Mack.
Thank you, Mr. Speaker and members. Just a final point in terms of the language that's in front of you. We've been going back and forth. A lot of advocates were not necessarily happy with the solo practitioner language that we put in here. The bill that as it came to the floor today allowed for an exemption with up to 7 practitioners. However, that made the department very uncomfortable, and in a good faith effort of trying to work with the Senate, trying to work with Senator Sharon, as we've agreed to work closely together on this and not have anything in there that was kind of a non-starter for either one of us. I've been trying to work with the department, and I will tell you that the department does not love the idea of having no penalty language put in place. However, I originally brought them language. They did not care for the no penalty language I brought forward, and so this is the language that they sent back to me saying, we don't love this idea, but if you're going to do it, this is the language we would have you put in. And I said, okay, I will take that language. And so this is what the department brought to me in terms of a concession on this point. Again, I'm not going to leave the impression that the department likes this, but members, we're kind of in a position here where, again, we have providers reacting, and I think the onus has been put on the providers to kind of follow through on an onerous government mandate, and their other option is to cease doing what they're doing, and the very important service that we need them to continue doing. And so it's not an ideal situation, but again, members, I think that this is the best way that we can make sure to allow for just the exemption for one solo practitioner, as Representative Pinto worked to do. It doesn't capture all of the providers out there within the 7% who have not yet been able to put in EHRs. That language does not help all of those folks. So by putting in this language, just ensuring that the practice of the department already is and is continuing to be, and they intend to continue to be, to not impose a penalty because they realize the burden that this is on the providers that we can least afford to lose. And so by putting this language in, we're just specifying what the department's intentions are, what the practice already is, and making that clear to providers that we're going to continue to work with them, these small providers. And again, members, I understand that this says that there shall not be a penalty to any provider, but again, 93% of the providers, and I believe all of the large providers, large systems, already have this in place. So we are really trying to come to the aid of these smaller practices. Some in my district, the ones that have a family practice of, the dad is a dentist, now the two sons are in practice. It's a small practice, but there's 3 practitioners, so under this language, they're not exempted. They are scrambling to try to figure out how they're going to comply, and they are in process to comply. But I think we need to give the assurance that while they're trying to figure that out, they're not going to have a penalty slapped on them. So again, members, with that, I ask that you vote against the amendment. Thank you, Mr. Speaker.
The member from Olmsted, Representative Norton.
Thank you, Mr. Speaker. And Representative Mack, perhaps the writing's on the wall here. I hope I've made my point. I think I have. I think you understand what I'm trying to do and the concerns. I also just want to clarify, though, 93% of the clinics, 99% of the hospitals, and 97% of health departments, 69% of nursing homes, my data doesn't go down as far as individual practitioners. So I don't know the percent of those. I just want to be clear about that. So what I'm going to ask Representative Mack and others, I would like a vote on this, and I'd ask you to support it. If my amendment fails, which unfortunately I think might happen, I'm going to ask Representative Mack if she would consider going into conference to have a really robust discussion about this particular sentence, because we do know the Department of Health is uncomfortable with it. I think there are some members that are uncomfortable with it. If you would have that conversation, please, moving ahead, and even consider something like a phase-out time, because for the larger providers, I don't think it sets a good precedent, as has been mentioned, to say we're not going to enforce Minnesota laws. So if we are going to delay the implementation or the enforcement of the implementation, a delay and a time certain might be more appropriate rather than just a blanket, we're not going to follow the law here in Minnesota. So I'd like you to consider that moving ahead. And members, with that, I do hope for your green vote on this particular amendment, and thank you so much.
Seeing no further discussion, all those in favor of the amendment signify by saying aye. Those opposed, nay. No. The motion does not prevail. The amendment is not adopted. To the underlying amendment, the Mack amendment. Discussion. The member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Members, I put together this language regarding solo providers, as Representative Mack referred to. Members should know that Department of Health did express concern about any change in the mandate at all. and for good reason. Electronic health records, as Representative Norton has said, contribute to patient confidentiality and safety and a number of things. But they did recognize that those benefits increase as the size of the practice increases. The reason I'm standing up right now is just to point out, from my own perspective, a lot of the misinformation that's been spread about this. And just for members and for the folks who've contacted us, to recognize, again, these records are not being placed online. There's no requirement that they be placed online. And this is, in fact, an exemption for solo providers. And finally, there is quite a bit of confusion about even the language of the amendment that's now contained in the Mack amendment. Just to confirm, we all are clear on this, that if you're a solo provider, you will be exempted from the mandate under this amendment. There's folks who have contacted me about some kind of ambiguity or confusion about that. As far as I'm aware, there's none. If members are concerned about that, please let us know. But otherwise, my understanding is no confusion about that. If you're a solo provider, this would exempt you from the mandate. Thank you, Representative Mack, for bringing this forward, and I ask members to support this amendment.
Seeing no further discussion, all those in favor of the 810-1 amendment signify by saying aye. Aye. Those opposed? The motion prevails. The amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
Pinto moves to amend House File Number 1535, the second engrossment as amended, and the amendment is coded A7.
The member from Ramsey, Representative Pinto, to your amendment.
Mr. Speaker, I'll withdraw that amendment.
Representative Pinto withdraws his amendment. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 1535 as amended.
Further discussion. The member from Dakota, Representative Halverson.
Thank you, Mr. Speaker, and I am going to rise in support of this bill. I really appreciate Representative Mack's work with the department to get some really important reforms codified. And a lot of the reforms that we're seeing, especially in regard to cracking down on Medicaid fraud, are expansions and codifications of work that the department has been moving toward over the past several years, particularly under the Office of the Inspector General. And we've seen staff at the Office of the Inspector General double in the last couple of years, which has been extremely important. It's been key, actually, to them doubling the amount of savings that they've been able to get when they've been looking at fraud and misbilling. And this really helps clarify that work. I think it's also important as we look at the goals of this legislation that we look at it with an eye of making sure that our departments have the resources they need to carry these reforms out. In the last legislative session, we definitely provided additional resources to DHS so that they could aggressively crack down on fraud and misbilling and overspending in the Medicaid program, and it's essential when we look at funding our departments that we provide them with those kinds of resources. So I appreciate Representative Mack's work on this to improve savings for our taxpayers and to improve the experience for those that are getting care within the DHS system, and urge you to support the bill. Thanks.
The member from Douglas, Representative Franson.
Thank you, Mr. Speaker. And members, there's two provisions in this bill, and I want to thank Representative Mack for including in her bill. Two bills that I had carried was House File 913 and House File 1881 for child care providers. House File 913 clarifies who must fulfill pre-licensure training requirements. Right now, when a provider moves from one county or another or closes her license or his license for a short period of time, licensors are requiring that providers go through all the pre-licensure training requirements intended for newly licensed providers. And here is a couple examples of how this has been harmful to providers and the families in their care. One provider had provided care for over 20 years, rented her home, and her lease was not renewed last year. There was going to be a period of a month or two before she could get into a new home to reopen her business. The county required her to take all the pre-licensure classes, which can sometimes take months to complete. She ended up closing her business. And then on House File 1881, This clarifies who must meet the attendance record requirement for publicly funded services. When this law was originally passed, its intent was to prevent fraud. If the state is paying for the care of a child for the CCAP, CCAP, Child Care Assistance Program, the state has the right to ensure that the child attends child care. DHS later expanded their interpretation of this to include children on the USDA food program as well. The food program does not reimburse providers based on time in or out. They pay based on the number of meals served, which must be recorded daily in a different manner than these attendance records. Requiring providers to also record time in and out in addition to meals served does not prevent a dollar in fraud. It does create yet another piece of paperwork providers must complete each day. Eliminating these redundant attendance records will ease some of the burden providers face with the mountain of paperwork that they must complete on top of doing a long 50 to 6 hour work week. Both of the bills were added to Senate File 1356. Both had no opposition from DHS or any other interested parties. They're simple bills that will make a profound difference for thousands of child care providers across Minnesota. And just FYI, members, Minnesota had nearly 12,000 licensed family child care providers in 2011. Today we have fewer than 9,700. And we continue to lose providers at an alarming rate. And we should be looking for ways to make it easier and less burdensome for good providers to stay in business. And these two pieces of legislation included in Representative Tara Mack's bill will start that process. Thank you.
Seeing no further discussion, the clerk will take the roll. Members, please vote. Moran votes aye. The clerk will close the roll. Moran votes aye. There being 121 ayes and 13 nays, 0 nays, the bill is passed as amended and its title agreed to. The next bill on the calendar today is Senate File 1191. The clerk will report the bill.
Senate File number 1191, number 3 on the calendar for the day, an act relating to family law.
The member from Anoka, Representative Scott, to your bill.
Thank you, Mr. Speaker. Members, one of the primary reasons that I ran for office in the legislature was to help improve the lives of families in Minnesota. And this desire led me into the often dreaded area of family law, making the process and outcomes of divorce and separation less damaging to every member of the family, particularly children, is worth the delve into this contentious area of law. In 2012, I carried House File 322, which was a bill that would have established a presumption for equal shared parenting. The bill passed the House, was altered significantly and passed in the Senate, but was pocket vetoed by Governor Dayton after adjournment. The governor contacted me by phone to explain that he was vetoing the bill because he felt like he was splitting the baby and wanted all stakeholders to come to the table. I shared my skepticism with him, as we had attempted to bring the stakeholders in before and asked for their input with little or no response. The governor assured me that I would have the full support of his staff in urging stakeholders to participate. So I want to thank Governor Dayton for urging folks on all sides of the issue to come to the table. So since late 2012, our group of stakeholders has has been meeting. We brought a couple of bills last year, and this year we have another package of bills. Hundreds of hours have been invested in this collaborative process, with everyone except our professional mediator donating their time. The foundation of the group's work is consensus. No proposal could move forward unless agreed to by all members of the group. Every provision in this bill has been discussed and agreed to by the entire group. You have in front of you, or should be handed out now, I think the pages are getting ready to deliver, a handout that explains the history and nature of our process. This process has not been easy, but it has been rewarding. No one got 100% of what they wanted or would have liked. What we have, though, is a package of bills on which we have reached consensus, and I believe will both improve the process of family court and the lives of children and families of Minnesota. Also being passed out should be a list of participants and their titles. We have a district court judge and a family court referee acting as individuals, family law attorneys, fathers' rights advocates, custody evaluators, child psychologists, legal aid representatives, and legislators. Our group's facilitator is Dr. Mickey Cashton from California, who is known internationally for her skills in conflict resolution. The group also consulted with other groups with expertise, including county attorneys and DHS. This year, our group was divided into 4 small groups. These bills, along with 2 bills contained in the HHS Omnibus Bill, are the result of this year's work. The Senate put these bills together in an Omnibus Family Law Bill, along with the Uniform Deployed Parents Custody and Visitation Act, which was carried in the House by Representative Lesch. This legislation brings much of family law into the 21st century. Much of current family law has been around since the 70s or 80s. There are areas of family law we did not touch, so more changes may need to be addressed in the future. The first segment of this bill is a revision of the decades-old best interest factors of the child. Our goal was to revise this part of law so that it was truly child-focused, which included recognizing the value of the child and each parent-child relationship. Recognizing that for many families, many things will change as a result of dissolving the family unit. The revised factors look at how a proposed living agreement will impact the child. In this respect, the new factors are prospective. These changes also make the factors more understandable so that parents can better understand what information the court needs when presenting information and can understand what the court considered in making a custody or parenting time order. Custody evaluators in the group felt that these were more concrete and evaluable than the current factors. It is important to note that no factor can be used in isolation. They must be examined as a whole, and the court must consider how they are interrelated. This bill also addresses the issue of compensatory time when court-ordered parenting time is lost, such as when one parent is hospitalized for a period of time, or when court-ordered parenting time is denied by the other parent, except to protect the child from physical or emotional harm. There's also a small language change that makes it clearer that the current presumption in law of 25% parenting is a floor, not a ceiling. We simply changed the language from at least 25% to a minimum of 25%. Another section of the bill contains a provision regarding full income disclosure from one parent to the other for the filing of income taxes. It also states that if one spouse does not have their tax returns completed, they must share the underlying tax forms and schedules. And of course, as I mentioned, the final pages of the bill are Representative Lesch's Uniform Deployed Parents Custody and Visitation Act, which was adapted by attorneys with expertise in family and military law to ensure that it fits with Minnesota's custody laws. This bill is supported by the Uniform Law Commissioners, the State Bar Association, and the Minnesota National Guard. This proposal is critically important to pass because Minnesota is the only state with no laws that address custody situations when military members are deployed. As a result, some veterans are losing their previously agreed upon custody arrangements just because they serve our country overseas, and there was some very compelling and heartbreaking testimony in committee about these situations. This proposal will ensure that military parents are not penalized for their service while still giving adequate consideration to the interests of the other parent and, most importantly, protecting the best interests of the children involved. It sets out procedures and substantive rules that apply specifically to custody situations involving deployed service members. At this time, I would like to yield to Representative Mahoney to explain his portion of the bill, and I'd also like to recognize on the floor today Representative Norton and Representative Lane, who are also part of our custody dialogue group.
The member from Ramsey, Representative Mahoney.
Thank you, Mr. Speaker, and thank you, Representative Scott. I also would like to recognize Representative Norton and Representative Lane for the hard work that this particular group did. This is an issue that has been, in many ways, I'll use the term that I would not normally use, festering at the Capitol for a very, very long time, more than a decade. I do remember more than a decade ago literally screaming matches in committees. And now, those people that were screaming at each other over the last decade have come together to try to move, and actually to move, family law into the present day and how families work, and unfortunately how families split up. I will say this, I've worked on this for a long, long time, and I am eternally grateful for the people who have, the legislators who have come forth and invested their time. And Representative Scott talked about hundreds of hours. She's absolutely right. We are, on occasion around this floor, prone to exaggeration. It was no exaggeration that it was hundreds of hours put into these particular bills. I ended up with 2 of them. And fortunately, I guess because they figured I was the longest serving member, they gave me the easiest bills. And I was very grateful for that. So with that, I will explain what pieces of the bills that I've carried, House File 464 and House File 446 do. Now, they are in the bill. I don't know if anyone asks, I can tell them where they are in the bill. But House File 464 is a bill that does 2 things. But the first one, in present day court systems, you get a parenting order. And attached to that is something called the Appendix A, which deals with the parent with the lesser parenting time rights to information about medical, school, scouting, any of the other things that any parent wants to know about their child. That's in an appendix stapled to the back. It's kind of like the fine print. And unfortunately, human beings oftentimes skip over fine print. So it's very difficult for parents that are not the custodial parents, as that's an old term, but have legal custody, joint legal custody, to get information out of their schools or any of the other things that pertain to their children. What this bill does, 464, is moves that appendix into the body of the parenting order, so that if you're reading the parenting order, parent gets every other weekend and Wednesdays, it's also in there that that parent gets information about medical, school, scouting, or any of the other things that any child would do. Then the other section of this, Section 3, is the judgment interest. That's the other piece that I carried. A number of years ago, we changed the interest on judgments from a court-determined number to a flat 10%. But in divisions of property, sometimes there's disagreement. So, and I'll use this example. you have a lake cabin, and one party gets possession of the lake cabin, but they have to pay the 50% cost to the other party. The other party feels that that's not quite right, and they appeal to the judge. They appeal to the court. And it can take years to get through that. All that time, that person who's been awarded the lake cabin is paying a 10% interest on that judgment. And one of the cases was that this happened, that's been explained in our group. It took years, and the participant that got the property ended up with a $50,000 or $75,000 interest payment more than they expected. So what this bill does, this section does, is change it back to the old language where the court, typically in January, sets an interest rate, more often than not around 4%, which is what they've been trying to do. They just don't want people to sit there and get free money. So it's changing it back from 10% to a court-determined percentage of interest. Again, typically it's around 4%. And then House File 446 clarifies the current practice that on occasions, not always, but on occasions, the child tax exemption is better suited to be awarded to the parent who has less time with the child. And in today's courts, they have determined kind of what I'll call a workaround, but there's no definitive set of rules that they have to follow. What 446 does is lays out the ability in the law that the courts have that ability to do that, to switch that child exemption to one parent or the other. But it lays out a section of 4 or 5 factors, and it's in one of your bill briefs, I'm sure, that court has to take into consideration when they do that. So does this affect the child? Does it affect the other parent's ability to take care of the child? Are all the facts true and fair? So what this is just doing is giving the court a roadmap and the requirements that they have to kind of follow when they do that. That's House File 464 and 446. There are other factors, and I'll yield back to Representative Scott.
Representative Scott.
Thank you, Mr. Speaker. I think it's okay probably to go to third reader unless there's other people that want to speak before that. But I was finished with my comments, and we would be open for questions.
Representative Scott, there are no amendments at the desk, so we can proceed to third reading. Third reading.
Third reading, Senate File Number 1191.
Further discussion to the bill. The member from Olmsted, Representative Norton.
Thank you, Mr. Speaker. I want to thank Representative Scott and Representative Mahoney and Representative Lane for all the work that they've done. As you can probably tell, this is very personal for those of us who have been involved. We've been working for almost 3 years now on this issue, and a lot more for some of you. What I want to explain is the importance of the process to us. This was a new process for the legislature. The governor set us on a path to go into some sort of discussion, and it became a formal mediation. It might be something that other contentious issues might want to consider moving ahead with or using in the future. It helped those of us that came with very different views, very different opinions. It helped us come together and learn to listen and be respectful to each other through this process. It was new for us. I think all of us would say we found it helpful. We worked hard on it, and we all feel a lot of ownership and pride in the work we've done. Representative Lane may want to address this, but she carried some legislation which I think many or most of us supported, moving the state forward using conflict mediation as a way to solve problems. And I think there is a place for it when you have people with such disparate opinions and views to be able to come and learn to find a common ground, to listen to each other, and ultimately, as you see here, come together with a package of bills that is supportable by all. And as was mentioned before I sit down, there are two other provisions. I carried one of those doing with child support payments, and there's a second one that's in Health and Human Services. I wish they were part of this package because it would be a full body of work, but they do affect the Health and Human Services budget and so remain there. And I anticipate that at the end of the day, we will have as much of the full package, I think, as we had hoped to pass this year. So members, I thank you for your time and attention, and I very much support this bill and would encourage you to do so as well.
The member from Anoka, Representative Lane.
Thank you, Mr. Speaker. And yes, the Office of Collaboration and Dispute Resolution started around the same time as this group and participated in getting this job done. And I would use this opportunity as this thing that we did here as an example of the power and possibility that can come through the Office of Collaboration and Dispute Resolution, and encourage that it continue to be funded as we go forth. We have worked on all these bills in this legislation together. Although we have different names on different parts of the bill, we feel the ownership for all of them. So I have a piece in the HHS bill because it has some funding, and so does Representative Norton because it has some funding. But we feel ownership of this whole entire process, and I appreciate Representative Scott taking the lead on this piece. You'll see from the sheet that I handed out a summary of how we got from one of the most emotionally divisive issues in the past decade to today with this legislation that makes carefully worked through changes in family law, changes that have the potential, at least, to make difficult arrangements for child custody and parenting time a bit less contentious. That's my hope, members. That's the goal of all of us who spent 2.5 years working together on this. Please join us in voting green.
The member from Ramsey, Representative Mahoney.
Thank you, Mr. Speaker. I'll be brief. I just want to thank the legislators that participated in this, but I'd be remiss if I did not thank, and I'm going to call them out, the Bar Association and Legal Aid. They have put hours into this, and they have really gone out on a limb to make sure that everybody understood and knew that they were in agreement. And I want to thank them. I want to publicly thank both those organizations and all the people that were involved in this. And thank you, members. I hope we can get 134 green votes up.
The member from Anoka, Representative Scott.
Thank you, Mr. Speaker, and thank you for bringing that up, Representative Mahoney. I, too, want to thank the Bar Association and Legal Aid. They were instrumental in both the House and the Senate in getting our message to members that weren't familiar with the process that we went through and with the family law bills that we've worked on. And members, I would just encourage a green vote to concur with this Senate file, and I thank you for all of your support. Thank you so much.
Being no further discussion, the clerk will take the roll. Members, please vote. The clerk will close the roll. There being 121 ayes and 0 nays, the bill is passed and its title agreed to. Reports from the Committee on Rules and Legislative Administration.
Pepin from the Committee on Rules and Legislative Administration, pursuant to Rules 1.21 and 3.33, designates the following bills to be placed on the calendar for the day for Tuesday, May 12, 2015, and establishes a pre-filing requirement for amendments offered to the following bills: Senate File Number 1679, 1478, and 857, and House File Number 1947.
Motions and resolutions. There are copies of the non-controversial motions that are placed at each member's desk and online. If there are no objections to these motions, they will prevail. Seeing no objections, the motion prevails. Announcements. The member from Hennepin, the Minority Leader, Representative Thiessen.
Thank you, Mr. Speaker. Just wondering if the Majority Leader will yield for a question.
She will yield.
Thank you, Mr. Speaker. Madam Majority Leader, just wondering if you could give the body any update on the progress that's been made, whether any targets have been reached, and what the prospects are for working over the weekend to get to a resolution on some of the budgets.
The member from Hennepin, the Majority Leader, Representative Pepin.
Thank you, Mr. Speaker, and Minority Leader Thiessen. We did meet again yesterday, and we will continue to work through negotiations.
Representative Thiessen.
Thank you. If she'll yield for one other question.
She will yield.
Thank you, Mr. Speaker. Are any negotiations planned for over the weekend?
Representative Pepin.
Thank you, Mr. Speaker, and Representative Thiessen. We had talked about coming and doing some discussions over the weekend on Sunday, likely.
The member from Carver, Representative Pugh.
Thank you, Mr. Speaker and members. It is National Small Business Week, and tomorrow is Small Business Saturday in Minnesota. Small businesses are the backbone of the American economy. They create more jobs than any other sector. This is an occasion to appreciate the 28 million entrepreneurs who represent 99.7% of the nation's employers. Small businesses generate nearly 50% of the annual GDP and employ more than half of the private sector workforce. When we shop small in our own communities, we help the local economy grow, which is vital to the economic growth in Minnesota. Let's support our state's brave entrepreneurs and shop small in Minnesota tomorrow. Thank you, Mr. Speaker and members.
The member from Douglas, Representative Franson.
Thank you, Mr. Speaker. Point of personal privilege.
State your point of personal privilege.
Members, today is Provider Appreciation Day. Provider Appreciation Day was started in 1996 by a group of volunteers in New Jersey. The purpose of Provider Appreciation Day is to recognize childcare providers, teachers, and other educators of young children everywhere. This day is celebrated each and every year on the Friday before Mother's Day. So today, when you pick up your children from childcare or from school, remember to thank the provider for the marvelous work they do. Thank you.
The member from Blue Earth, Representative Cornish.
Mr. Speaker and members, the Public Safety, Policy, and Finance Committee Conference Committee will meet 15 minutes after session in room 400 South.
The member from Sherburne, Representative Knobloch.
Mr. Speaker, members of the House, the Ways and Means Committee will meet on Monday at 1 o'clock, not our usual 10:15 meeting. Ways and Means 1 o'clock on Monday to take up a couple of smaller bills.
The member from Fillmore, Representative Davids.
Thank you, Mr. Speaker and members. Tax Conference Committee, 2 o'clock p.m. In the Capitol here in our regular room.
Announcements. The member from Hennepin, Representative Pepin.
Thank you, Mr. Speaker and members. I move that when the House adjourns today, it adjourns until 3:30 p.m. Monday, May 11th, 2015.
Representative Pepin moves that when the House adjourns today, it adjourns until 3:30 p.m. on Monday, May 11th, 2015. All those in favor signify by saying aye. Those opposed, the motion.
I move that the House do now adjourn.
Representative Pepin moves that the House do now adjourn. All those in favor signify by saying aye. Those opposed, the motion prevails. The House is adjourned until 3:30 p.m. Monday, May 11th, 2015.